Vicky, you're here. Yeah, I can see Vicky. I think there's quite a few people probably still to join, but I think we'll get started. So thank you everyone for joining us for today's forum. We're looking at the ongoing and future challenges faced by survivors due to COVID. As many of you will remember, about a year ago, when the lockdown started, we started these online regular COVID forums. The idea was to share best practice and challenges. And last autumn, as the expertise and understanding grew, we obviously returned to more general forums. But now that it's been 1 year later, we're really delighted to be pairing up with Rights Lab in Nottingham University to be discussing their research on the ongoing impacts of COVID. But before I pass you over to Vicky, who has done all the main work for this event, I've just got a few points that I just sort of notes for people, for the audience. So first, just to keep in mind that Survivors Alliance guidelines, that if survivors are present, please just ensure, particularly in the breakout rooms, that you're sensitive and respectful when responding to participants' disclosure. And also be mindful of asking for details about someone's trafficking experience. You know, they don't have any obligation to tell you about that. Please also use the terminology survivor to refer to people who've exited slavery, and don't use the term they, them. Hello
everyone.
Hi. Also, just another note, that no survivor involved in the Rights Lab projects shouldn't feel in any way obligated. So now that's done, my second thing is to pass over to Jasmine, who's going to, my colleague Jasmine, she's new with the HTF, so say hello to everybody, but also she's going to just explain a bit about the Zoom and the breakout.
Hi everyone. We made a test breakout room, and if you can't see that room, if you update your Zoom, instructions are in the chat. Thank you.
Sorry, the sound's gone a bit odd, but yeah, basically look at the chat in terms of making sure you're on the right Zoom for your breakout rooms. I'm also just going to hand you over quickly to Phil about the Q&A session.
Good afternoon, everyone. First of all, I apologise for appearing in front of you wearing a hoodie, but it's for some reason it's really cold, so I've had to dress down today. As you know, I'm usually in charge of questions. It usually goes wrong for me, so I always think it's important to apologise before I start. I will do my very best. We are going to have a Q&A session, I think, just after the Rights Lab. So right, I've got that right. So if you've got any questions that come to mind, you can either message me directly. So just in the chat room, if you look for my name, you can send me a message directly. If there's for any reason that you don't want me to mention your name, then that's fine. I can deliver the question for you. If you would much rather ensure that if you'd much rather ask the question yourself, then that's not a problem. Just put that in the chat when you send it to me. We will get through as many questions as possible. So yeah, up here, if you hover your cursor over that, you'll see 3 little dots. If you click on that, you'll see a message to chat to me. So hopefully that will work. As I say, we'll get through as many as possible, but by all means, send a message, send your questions as they come to mind whilst we're going through today.
Great, thanks, Phil. And now I'm going to hand over to Vicky, who has been sort of leading on the Rights Lab research.
Thanks so much, Tamara. I'm just going to ask my colleague to also join me, Erica, who's going to share some slides, hopefully. There you go. Brilliant. So thank you very much to the Human Trafficking Foundation for putting this forum on. I'm Vicky Brotherton. I work at the Rights Lab at the University of Nottingham. Since last summer, the Rights Lab has been working with the University of Sheffield and a number of NGOs and networks, including Survivor Alliance, including the Human Trafficking Foundation, ATMG, Flex, and the International Anti-Human Trafficking Network, to undertake a research project to look at the risks and impacts of COVID-19 on modern slavery survivors, with a specific focus on the UK and US. We've been really fortunate to have a research advisory board supporting us with this project, made up of 10 survivors based in the US and UK, who so far have helped us in a number of ways, including thinking through survey and interview questions and helping us make sense of the survey data. And we're glad that some of the advisory board members are here in attendance today as well. So we wanted to use this forum for two purposes, really: to share some of the findings, some of the key findings from the research to date, and secondly, more importantly, to hear from you about whether the research findings really resonate with your own experiences of the pandemic and supporting survivors through the pandemic, or whether there are additional challenges that the research hasn't quite touched on that you think should be flagged. And crucially, as we transition out of the pandemic, hopefully, if there are ongoing challenges, then we'd really like your ideas around how they can be addressed. So in about 40 minutes, we're going to ask you, after the presentation and the Q&A, we're going to ask you to self-select a breakout room focusing on one of three overarching themes. So theme one is going to be around adult survivor health, well-being and access to support services. The second theme will be around access to legal support and all things immigration related. And the third theme will be around children, risk to children as a result of COVID. So as you listen to the presentation, please try and keep these themes in mind and be prepared to select a breakout room after the presentation and come kind of prepared with your ideas and thoughts in response to what you hear in the presentation. The plan is to write up anonymized notes from each of the breakout rooms and develop a kind of briefing paper so that we can share those back with you, so that your ideas can be recorded, disseminated to the right people and hopefully acted upon. So I'm going to hand over to Erica, who's going to talk you through some of the key findings from the research so far. Thanks, Erica.
Hello everyone, it's great to be able to be here with you all and to share some of the initial findings of this research. So today I will give an overview of some of the key areas of risk and impact that have been highlighted in this research to date. And I'm going to try and integrate some mitigating responses as I go along, although I may not have time to cover that many responses. But before I move on to exploring some of the key findings and sharing those with you, I want to give a quick overview of the three strands of this project and to share a bit about the demographics of the survey participants, as I think this will be helpful for us as we kind of explore the themes in more depth. So there are three strands to this project: a survey that was conducted with survivors, a rapid evidence review, which I'll explain a bit more about in a moment, and also web monitoring aspect to this project. So web monitoring, so we monitored Twitter communications to understand what key anti-slavery organisations were discussing in relation to COVID and its impacts on survivors. And that was done between January and September 2020. This second strand of the project, the rapid evidence review, involved analysing 106 relevant sources of grey literature between the 1st of March and the 31st of October 2020. Of these sources, 40 had an exclusively UK focus, although some of the other sources may have referred to the UK context or given examples in the UK context. And when I say grey literature, what I mean by that is we looked at NGO reports, policy briefings, maybe blogs of anti-slavery organisations, as well as government documents. So we didn't look at academic sources or literature. And then the third strand of the project, the survey, so 102 survivors took part in this survey, and that was done in December 2020, of which 56 were survivors who are based in the UK and the rest in the US. Out of the UK participants, 91% identified as female, 6% as male, and 4% as other. The countries of origin of participants included Nigeria at 40%, the Philippines, the UK, and survivors also listed Russia, Mongolia, Botswana, Congo, Indonesia, Kazakhstan, Malawi, and Mauritius as countries of origin. So I think this is maybe just a bit of background information that's helpful to bear in mind as we move on to discuss the findings. So in this presentation, I'm going to be drawing on three parts of the survey. First, there was a question where survivors were asked how they had been impacted by COVID-19 since the start of the pandemic. So this survey was taking place in December, and this question was kind of looking back retrospectively. And the participants were provided with a list of 14 pre-selected categories, of which they could select as many as applied. So I want to draw your attention to the top of the graph, where you'll see 73% of the participants selected indicated that their psychological health had become somewhat or significantly worse since the start of the pandemic. 66 selected relationships with wider family and friends, 65% selected financial status, and 57% selected ability to return to country of origin as something that had become somewhat or significantly worse since the start of the pandemic. Now, we're going to be looking at some of these themes in a moment. The second part of the survey that I want to draw your attention to is another question that was asking participants what they expected the main impacts of COVID-19 would be over the next 6 months. So the last question was kind of looking backwards, and this question was sort of looking ahead and asking what survivors anticipated were going to have that COVID-19 was going to have an impact on. So again, if you look at the top of that graph, you'll see 63% of participants selected psychological health. So again, that appeared at the top of the categories that were selected in this question as well. 59% selected physical health, and 55% selected financial status. If you remember, financial status came up in the top 3 of the previous question as well. And then access to support services was selected by 39% of participants. So these are kind of going to guide some of these themes that came up top, are going to guide some of the themes that we're going to be exploring in the rest of the presentation. The third part of the survey that I just want to kind of flag, because I'm going to be drawing on this throughout the presentation, is a question that was asked of participants in a kind of open-ended response. They were asked, what would you like people in power to know or to do to address some of the past or future issues related to the COVID-19 pandemic? And in the survey, when it said people in power, it listed local government, national government, NGOs, or others. And I'm not going to read some of these responses because I'm going to be incorporating those as we discuss the themes in turn. So a lot of the risk categories that were selected in the survey that I've just kind of highlighted in those graphs were also discussed in the other strand of the project, the evidence review. So for example, psychological health, physical health, financial status, access to support services, these were all discussed at length in the evidence review. However, there were some additional themes that emerged that I think are worth mentioning that came up in the evidence review. One was digital poverty and exclusion, and how this really impacts upon a host of other access to other services, including mental health services, medical services, access to various forms of support, free school meal entitlements, and education, and so on. Access to information about COVID-19 entitlements was also flagged in the evidence review. And then there were fears that discrimination towards migrant workers in particular would increase as a result of the COVID-19 pandemic here in the UK. Also, risks to children of online sexual exploitation, trafficking, criminal exploitation, and child marriage were discussed at length in the evidence review, and we will be discussing this in the breakout rooms, in one of the breakout rooms. So taking the findings from the survey and the evidence review and bearing those in mind, also kind of in preparation for our discussions in the breakout room discussions, I want us to focus on how COVID-19 has impacted upon the following: the psychological health of survivors, financial status of survivors, physical health, especially concerns around COVID-19 in particular. We're also going to have a little look at legal documentation, and this includes the rights of domestic workers. This was flagged up in the open-ended responses of the survey question, as well as the evidence review and the web monitoring. And then we'll also discuss risks to children, which wouldn't have been captured in the survey because the survey was conducted with adults. So we're going to move through the themes together. The first one is psychological health. So this came up top in those graphs, if you remember, at the start of the presentation. And in the evidence review, there were numerous reports that survivors had faced issues accessing mental health services due to reduced capacity and also because of digital poverty. There were reports that pre-existing mental health issues had worsened during the lockdown, and that lockdown itself had been a trigger of past traumas. There were concerns that safeguarding issues may have been or could be missed that wouldn't be had in-person support been delivered. There were reports that uncertainty around immigration status had been a source of anxiety for some survivors during the pandemic. There were also reports that reduced participation in education, work, voluntary work, and support groups had negatively impacted upon the mental health of survivors. There were also concerns raised that testifying remotely to legal representatives or the Home Office without in-person support and without follow-up support could be traumatic for survivors. In terms of responses, it seems from the evidence review that some organisations redirected funding at the start of the pandemic to be able to provide digital devices and data packages to survivors. Alongside this, there were also reports that many devices promised by the government hadn't actually been received by service providers. There seems to have been, according to the evidence review, strikingly few responses to what will be an ongoing and long-term challenge for survivors. But again, we're really keen to hear what your experiences are in the breakout rooms and in the Q&A session. In terms of the web monitoring, it's actually quite notable that only 1.8% of the 479 tweets that were monitored actually discussed mental health factors. So this is kind of at odds with the extent to which psychological health was discussed in both the survey and in the evidence review. So I'm just going to turn now to some of the requests made by survivors who took part in the survey, who are based in the UK, and I'm using their exact words. So one survivor requested, provide specific helplines and support for COVID-related mental health issues. Another survivor said, local organisations should have arranged video calls for mental health issues and help, as nobody offered me and I'm not comfortable to ask anyone. Another survivor said, mental health to remain open at all times and food banks, which brings me to our next theme that we're going to be looking at, and that is financial status. So again, this came up in the top three in those two graphs that I shared at the start of the presentation. In the evidence review, there were reports that partial closures of food banks and baby banks had increased financial pressure on survivors who would normally use these services to supplement financial assistance that they would receive. Also, due to a rise in the cost of essential items, some individuals were unable to afford mobile data or credit, and there were reports of some individuals having to make decisions whether to buy food or hygiene products or food or being able to stay connected through mobile data and credit. There were reports as well that there were challenges when it came to accessing universal credit, and that some survivors experienced delayed payments of financial assistance. Again, we're keen to hear whether this reflects your experiences. And then survivors had been impacted as well by loss of employment, with a particular mention of those on 0-hour contracts. The web monitoring kind of reflected the findings of the other two strands of the project a bit more in this category, with 15.51% of Twitter communications that we looked at discussing economic factors. And again, I'm going to just turn to some of the requests that were made by survivors in our survey who were based in the UK. One survivor said, take into account that the more we stay at home, the more we get depressed and the bills are going up, so we need extra money. And another survivor suggested that there should be bonuses for carers. Moving on to the next theme, physical health, especially this was to do with concerns around contracting COVID-19. In the evidence review, concerns were raised that survivors were disproportionately at risk of contracting COVID-19 due to various factors. One, that overcrowded accommodation where self-isolation was not possible. Another reason why survivors were disproportionate risk of contracting COVID was because of their inability to self-isolate due to financial pressures or lack of government funding to be able to stay at home and not perhaps work. Pre-existing health conditions were also flagged, some of which may be connected to historic or current exploitation. Delays in initial health screening, and this was mentioned in particular when it came to newly arrived unaccompanied asylum-seeking children. And also there were reports in the evidence review that there was a reluctance amongst some survivors to access healthcare for COVID-19 due to fears of deportation, issues with language barriers in the NHS, concerns about costs being unaffordable for treatment, that some were being controlled by traffickers and unable to access healthcare. And also another thing that was listed was that some had experience of racism in healthcare in the NHS, and that had deterred them from seeking treatment. In terms of responses, whilst the government made healthcare for COVID-19 related matters available to all, regardless of immigration status, it does seem that more needs to be done to communicate that these entitlements exist and that data will not be shared with immigration authorities by healthcare staff. And again, in terms of the web monitoring, this also reflected the other strands of the project, with 14.77% of the Twitter communications that were looked at discussed physical health factors, in particular concerns around COVID-19. And again, returning to some of the requests made in our survey by survivors, one said that there needed to be clearer communication and consistency on the rules, as it's been very confusing. And another survivor suggested that there was the need for more open hours for GPs. Okay, so just moving on to our next theme, which is legal documentation and also including the rights of domestic workers. As I mentioned previously, this was really captured in some of those open-ended responses in the survey. It also was flagged in the evidence review. There were reports that survivors had faced longer delays accessing legal support and that the challenges that existed pre-pandemic had been exacerbated. There were also reports that there was lack of privacy, lack of childcare and barriers to communication when meeting remotely with legal representatives and asylum authorities, with this kind of switch to everything moving sort of remotely rather than in person. And then in relation to domestic workers, this group were highlighted in the global sources that we looked at, but also domestic workers living in the UK were also discussed in the evidence review. And this included a report of a domestic worker who'd been left destitute following the Home Office's decision to end support following a negative conclusive grounds decision. And there were also concerns raised that domestic workers were not able to self-isolate as they needed to work, with examples of them needing to work to save money for a visa. And in the web monitoring, domestic workers living in the UK were flagged in the data set at those at risk of exploitation and also destitution. So that kind of mirrored the three, that was mirrored across the 3 strands of the project. And again, moving to some of the responses in the survey and the requests made by survivors. One survivor said, "Give amnesty to all. Illegal disabled people should be allowed to stay in the country and access free healthcare." Another survivor said, "I know it's more difficult, but I hope the government will reinstate the pre-2012 visa for domestic workers." And this response was reiterated a number of times. And finally, a survivor said, "The national government must listen to our voices that we are fighting for our rights as undocumented domestic workers. As a victim of human trafficking in this country, like me, how many years I didn't see my son and family to my origin country." Moving on to our final theme, risk to children. So the survey won't have captured the risks facing children necessarily, because the participants were all adults. However, in the evidence review, children were identified by a large number of sources as a population who are at a heightened risk of exploitation as a consequence of the pandemic, in particular school closures, not only kind of at a global level, but in the UK as well. And sources in the evidence review noted that the online sexual exploitation of children had increased during the pandemic here in the UK. That perpetrators worldwide had adapted and shifted to online methods of exploitation, targeting children in particular, and that newly arrived unaccompanied asylum seeker children who were required to self-isolate for 14 days in unsupervised accommodation, that they had been placed at a potential risk of being trafficked during that time frame. In terms of responses, it seems that according to the government sources that we looked at, that they have recognised the risks facing children as a result of the pandemic, particularly in relation to online sexual exploitation due to the school closures. But what was less present in the evidence review was references to forced criminal exploitation of children and the risks of child marriage in the UK. So just to draw this presentation to a close, and before we have our Q&A, it seems from the evidence review that there have been piecemeal responses at government level to the complex issues facing survivors of modern slavery as a result of the pandemic. And civil society organisations seem to be leading the way, but we're conscious that the evidence review won't have captured all the interventions that have been put in place, and I certainly haven't captured all the responses that we saw in the evidence review during this presentation because of time restrictions. So in the breakout rooms, we are really keen to hear from you experiences of good practice so that they can be shared and replicated where appropriate and if necessary. So I'm now going to hand back to Phil, who has been keeping track of the questions in our chats for our Q&A, and I also encourage other members of the Rights Lab team to be ready to respond to some of those questions alongside me. Thank you very much for listening to me.
Thanks, Erica. I love the confidence you have in my ability to get the questions right. So thanks for that. I am lacking in questions, so if anyone wants to send some through, then please do. The first one I've got is just in relation to the respondents from your questionnaires, and it was, you noted that there'd been a lack of number of males that had responded to the survey, and I just wondered if you had any thoughts on that as to why.
Hello, everyone. Hello.
Hi, welcome.
Yes, sorry I'm late.
That's all right.
Yeah.
Hi there, this is Emily. I'm from Rights Lab. I designed the survey in collaboration with our research advisory group and the whole Rights Lab team. Interestingly enough, the vast majority of respondents across both the UK and US participants identified as female. And we weren't 100% sure whether that was a factor connected to the way that Survivor Alliance membership attracts members. So that would be another interesting point that potential point that I'd want to raise with Min, but we weren't 100% sure actually why that might have been. Min, is it the case that the majority of Survivor Alliance participants are female, and do you have a sense of why that might have been?
Yes, so that is the case, although we do have male members, and we also outreach to service providers who serve men, but it is documented that services directly for male survivors are limited in comparison to service provision for women or females. And so, I don't know if we do have trans members in our larger membership, but still also a minority. So I think it actually demonstrates the field in itself, because our membership is highly recruited through existing NGOs and word of mouth. So the word of mouth piece is where we have, I think, some of our male membership, but why it can also be difficult to expand.
Thank you both for your answers. Just one other question at the moment, and it was just in relation to the element around domestic workers. I found that quite interesting. I know Stop the Traffic they actually ran a campaign during COVID-19. One of the things that came to fruition was particularly around the number of people engaged in domestic service who felt forced to actually start working or staying at the homes that they were working at. And I just wondered if that was something that had been covered by the survey, or was maybe a little bit too bespoke or specific in relation to the questions you'd asked.
Yes, that's great. So we didn't specifically ask about domestic work in any way, and we didn't ask, we only asked very, very minimal background information of the survey participants, so age, gender identification, and country of origin, around or in line with ethical guidelines connected to only asking for absolutely critical information that's pertinent to the themes of the study. And so given that our study was around COVID impacts, it was very broad themed. We didn't go into specific, people's backgrounds. However, what we did notice was that that domestic work theme came up in a lot of the open-ended, or at least non-trivial number of the open-ended questions that we asked for the UK specifically. And so we knew that we were picking up people who had been exposed to exploitation in domestic work context that way. So we didn't specifically target it, but it came up in the UK sample specifically.
Thanks, Emily. You're doing really well at my questions. So I've got just one final question, and this is really about, so during the first lockdown in particular, certainly our understanding was that there was an expectation for survivors still to travel in person to the Home Office. And obviously, and I just wondered if this was something that was highlighted in the concerns.
You mean in the open-ended questions? So yeah. Whether it had come up spontaneously, not specifically around travel to the Home Office, certainly not, that didn't come out, but the open-ended questions, so although we got a range of questions, the open-ended questions were still at least we had two. So one was, what specific actions would you like people in power to take? And the other was, what would you like to tell people in power? So if that were to have come up, I think it would have come up there, but it didn't seem to come up as a priority where people were asked to, basically make one statement. So it didn't come up, but we didn't specifically target that in our survey questions. So that might be why.
Brilliant. Okay, and in terms of questions, that's it for the moment.
I think we're now going on to our breakout rooms. You can see Jasmine's put in the different rooms on the right. Vicky, do you want to say anything about breakout rooms before we get started on them?
Yes, sure. This is where we say a little prayer to the technology gods and hope that you all manage to able to get to a breakout room. So you should see on the bottom of your screen an icon that says breakout rooms, and it will have 5 listed with the titles of each breakout room. So the first 2 breakout rooms are on theme 1, which is around adult survivor health, well-being and access to support services. We've created 2 groups just because of the numbers. They'll be discussing the same issues around psychological health, physical health, etc. And we are hoping that by random selection, we might get an even number in the breakout rooms. But if not, you might find that you are moved quietly by Jasmine to another breakout room, so don't be alarmed. And the second theme will be covered in breakout rooms 3 and 4. So that's theme 2, legal support and immigration related issues. And then the 5th breakout room is around children. So we have 40 minutes. Well, yeah, about 40 minutes. We'll ask you to come back at around 3:25, 3:30 into the main plenary session again, where we will be sharing kind of updates from the discussion in each breakout room. So please go ahead if you can and select which room you want to join. It will just say join and it will take you into that breakout room and you'll leave this main session.
For example, and to online shops. Let me have a quick look. Geographical area and location, and this urban rural problem impacted, I think, further, or people felt it impacted further on access to services. So what might be available in London wasn't available to people in very rural areas. People talked about, and well, Liz summarised it up as kind of the postcode lottery, that if people were living just 10 miles closer to a particular geographical area, they would have had better access to support, which just wasn't available where they were. There was talk when we talked about kind of the transition now out of kind of lockdown and out of the kind of the pandemic. There were concerns about that the review of the NRM and support within the NRM taking place during this period wasn't helpful, because it's led to doubt in terms of what support will be available, what can people expect. So, for example, the examples that were used were kind of, will medical support be available to support people to attend vaccinations, etc. And there was a lot of talk about kind of vaccines, take up of vaccines within this population and how to support people with that, and also some of the concerns that survivors might have in terms of accepting a vaccine. People talked about kind of the emotional barriers of engaging with kind of medical care and support, the need for trauma-informed communication process throughout all the different services that survivors may come into contact with. And I think an important point, again, raised by our Survivor Alliance colleagues, was about diversity in the workforce and diversity within the sector, and how if we had a more diverse workforce, that may help individuals to engage. People talked about the importance of empowering survivors and, you know, supporting people to kind of see the light at the end of the tunnel. That might be difficult for them. And there's also kind of talk about kind of could there be kind of outreach, and that's my term, outreach services from like local authorities to actually kind of go out and provide direct support to people who may be lonely and isolated and cut off from their communities, and maybe who are not able to engage with their GPs. So that's kind of my summary there. But like I said, that does not do justice to the depth of discussion and the sharing that people did in our room.
Thank you, Nicola. That's a brilliant summary. Liz, is there anything else you want to add, or are you happy with that summary? Great. Fab. Thank you. Yeah, and just to say that as part of the research that Nicola just touched on, Survivor Alliance are doing 3 rounds of in-depth interviews with 10 survivors in the UK and US. We don't quite have that data ready to share yet, but we'll be sharing it in due course. Thank you, Nicola. The second breakout room was also talking about theme 1, so adult survivor health and wellbeing and access to support services. And that was Tribeni and Emma. I'm not sure who's the one to report back.
I'm going to report back.
Thanks, Emma.
So we also had a very rich and interesting discussion. We started by talking about reflections on the research findings, so how they resonated with the experiences of people in the group. And certainly again around accessing mental health services, particularly a time when people's mental health was becoming worse, was raised as a particular area of concern. Also getting financial support was also problematic. And there was a very, things change really rapidly, just over a few hours when you're working with people in crisis, you're having to shift from face-to-face meetings to everything going online. And, that's very tense and very difficult for everyone involved. And, again, the issue of digital poverty, not everyone has access to the relevant devices that they need in order to be able to access online support. Well, let's have a look. So yeah, so also we talked a bit about how survivors with children found it particularly difficult if they were on their own with kids once lockdown happened. So not feeling welcome in shops if they had their children with them, but having no one to look after their children. When shops ran out of things, not having any support networks in order to be able to access things that they needed. So a lot of the things that were mentioned from the research really resonated with the experiences of people in the room as well. So then we went on to talk about the types of interventions that groups had implemented in order to mitigate some of the projects. So someone talked about the need for a very sort of rapid assessment very quickly once COVID happened, in order to be able to work out who needed more support. Some people even needing support daily. The sending out of craft and activity packs along with food and toiletry parcels, and just regular texts just to say we're just checking in with you, is everything okay, just to give someone a boost and to let them know that they're being thought about. There was money available from funders for things like digital access. So there was a National Lottery COVID-19 fund, and another funder that group worked with made it easy to access money for COVID very quickly. One of our participants in the group works for a dance charity that does dance therapy with survivors, and their sessions all had to go online. And again, the digital poverty was a real problem here because people needed devices. So that was something that they had to work with. But they also were able to then reach survivors outside of their local area. And also men began participating as well in a way that they hadn't done before. We had a bit of a talk about online safety, whether there were any trainings done on online safety. None of our participants had actually done any training per se, but they had made sure that they'd had one-to-one conversations with people about safeguarding and discussions about cyber safety, even using, so for instance, if people didn't speak English, understand English, they found resources on YouTube around online safety. So what are going to be the ongoing problems about accessing health and support services? So housing was going to be a definite challenge. There have been problems during COVID, for instance, with trying to relocate people outside their local area for safety reasons, but that just becoming increasingly more tricky and more difficult. We also talked about the need for support for the people providing the support as well, because during COVID, a lot of the supporters, a lot of the people working with survivors also had their own crises and problems. We talked about accessing support, health support, and also vaccinations, but vaccinations didn't seem to have come up as an issue so much yet, possibly because of the age group of the particular individuals that were being supported. So what action needs to be taken by whom to address these risks? We talked a bit about campaigns and letters and writing to MPs and going to talk to them, the normal kinds of things. But also there's a need really to sort of cut through the red tape. we have to be making sure that when people are signposted, it's to the right place and they can get the support they need. And I think the final thing that we talked about was the transition period, about, you know, sort of being realistic and managing expectations and identifying that there's going to be a transition period when we go back into offices. You know, we're still going to want to provide some support online. We need to make sure that we keep funds aside to provide online support for our activities. But also there's been lots of positives learned from the online support as well, and things that perhaps organisations will want to carry on with. Yeah, I think that's about it from our group.
Brilliant, thanks Emma. Again, really super rich discussion there. Thank you. Room 3 was talking about the second theme, which was access to legal support and immigration related issues, and that was Rebecca as the chair and Anne as the note taker. I'm not sure if Rebecca, yeah. Hi.
Thanks, Vicky. And yeah, just to echo what people have said, it was a really valuable exercise and it was really great. We found as a group reflecting to have, I guess, so many different perspectives and experiences from people who had been in quite different roles and positions throughout the pandemic. So I just want to say thank you, Vicky, for actually organising this space, because it was really positive, a really positive experience for us. And yeah, so to go over some of our reflections and discussions, the group were very much saying that, yes, the research that the Rights Lab have done and the findings are reflective of what's been happening on the ground. And, you know, specific sort of elaborations and comments we had about that were in the context of immigration and access to legal advice. A big issue that people found were the delays. So, you know, delays across the board in terms of immigration decisions, delays across the board in terms of trafficking decisions, and just processes in general being a lot slower, and that having a massive impact on mental health. So not only obviously having, I guess, the concerns and anxiety that have come with the pandemic, but that being exasperated by having more and more uncertainty about someone's position and, you know, the outcome of these decision-making processes. It caused a lot of mental distress. And I think the general comment actually that was fair to say was that a lot of these issues were pre-existing, but the pandemic exacerbated them in relation to the immigration system and access to legal advice. So they were worsened. And, you know, an example was talking about access to solicitors and how, you know, some people had an experience of solicitors going on furlough, but this not being communicated to the client. And so, you know, the case has just kind of been dropped, or there's been no communication about what's happening. This can cause a lot of anxiety. And, you know, also, I guess it can delay the case itself, that kind of handover of staff. And there were reflections about how basically, yeah, with the economic impact on firms and solicitors, how, you know, the caseloads could have really gone up for certain solicitors, and that's going to have a flow-on impact. And for many, some people may only have contact with the solicitor, and, you know, to not hear from someone for a really long period of time is really, you know, concerning and can have a lot of impact. We talked about how some work had been able to shift remotely, but this could come with its own issues. And so looking at how, you know, information is interpreted by the courts, this could be in relation to witness statements, in relation to being able to obtain, you know, medical evidence and other expert evidence. And, you know, it's kind of a flip side, isn't it? On the one hand, it was really positive the courts were open to adjourning matters because there needed to be more time to gather appropriate evidence. But on the other hand, that also was delaying things. So it's, you know, it's come with increased difficulties. Obviously, some people couldn't access doing hearings and things remotely. So that was an issue, or there could be risk having to travel in person for things. So it's just been really difficult to navigate practically. And we discussed a little bit about the everyone in policy and kind of how, you know, that there was a potential shift around no recourse to public funds and local authorities' ability to accommodate. But there were comments around how this seemed to be discretionary for some local authorities. There wasn't like clear, consistent practice across the board, which in itself could cause issues and confusion about where people could get support or get accommodated. On the flip side, there was some positive examples and feedback of how that had allowed local authorities and people working with local authorities to really provide and be able to assist more around the point of identification and make sure that NRM referrals were being done, you know, really well, and support could be in place around that process. So that was good to hear. We also heard of a local authority that really tried to support survivors and you know, really enforced and everyone in policy and provided that support. However, the issue was that many survivors felt that they couldn't trust the local authority because of fear of, information being shared with immigration enforcement. So still that kind of barrier to identification, because people were feeling it's unsafe to go to a local authority or to a public authority and, and ask for support because of that fear of immigration enforcement, detention and removal. I'm talking very fast, I've got a lot to cover. Sorry, I always seem to whip through things with excitement. So yeah, we talked a bit about how there was obviously the real issue, and it was a previous issue, but it still remained, how there's a lack of legal aid provision pre-NRM. So people unable to get advice about their rights, unable to get advice about their options, before going in, unable to make informed consent if they haven't had the ability to access that advice. And obviously that putting a burden on organisations on the ground who are first responders or working closely with first responders and are trying to kind of fill a gap here. With very limited resources, and in some cases not being able to do that because of restrictions around giving immigration advice. And there was discussions, and a kind of an exciting example actually, how in Scotland there has been funding available for there to be immigration advice and advice given with partners and pre-NRM, and the impact that that's had in a positive way of people getting to be able to give informed consent because they've had some of that advice. I was very excited about that part. I was like, oh, go Scotland, come on England, come on Wales, that's what we need. So there was discussion about, yes, people have been trying to adapt and use the resources the best that they could, and many activities had to be stopped and adjusted, but that flexibility also sometimes did allow for more in-depth service or information that could be gathered that hadn't been previously, which was positive. One thing we also talked about was the rapid changing of guidance over this period. So, the multiple changes of the Modern Slavery Act guidance and also the RNAs completely changing, across the period, and that being confusing for everybody, confusing for survivors trying to access support, confusing for support providers, solicitors trying to keep on top of all these changes. And we did have some general discussion about the RNAs and, the confusion really around originally the government saying that people wouldn't be exited from NRM support, and then whether that was just safe houses or whether that was outreach. Has the position changed over time? It was evident people were being exited from support, or if they were getting RNAs, they were being granted very, very short periods of time. But equally, it took a lot of time to challenge those decisions and to try and get legal advice to challenge, negative RNA decisions. So there was a lot of conversation really about how that's been a really hard process. And again, the mental distress that's caused people, knowing if their support is going to be terminated or support only being extended for a very limited period of time, despite ongoing need. So as we transition out of the pandemic, we, I guess we're pretty universal in saying that there needs to be a focus on pre-NRM support and legal advice. We talked a lot about how, it's not just about survivors that have been identified, but the many communities and people that are vulnerable to exploitation in the first place, but the lack of ability to access, any legal advice or immigration advice until, that point of a reasonable grounds decision means that, we're not preventing exploitation taking place. And as a group, we were concerned that that's really going to be, well, it's been exacerbated by Brexit and also by the pandemic. So, we've seen a lot of sectors that are sort of at-risk sectors, we should say. And I think with, limitations on immigration status, really inappropriate or non-existing routes of migration, it's going to cause, an increased need for access to this advice. And the concern is obviously that advice isn't available, it's not funded, routes are not available for people. And so, there's going to be a concern of unidentification taking place, but also an increased risk of exploitation for many. So that kind of really informed our actions of what needs to happen going forward. Then the overall message was we need to change the way that this is being seen. This should not be seen through an immigration lens. And actually we were all very much saying survivors need to have a right to work in the NRM. There needs to be legal advice available pre-NRM, so people can actually know their rights and have those rights enforced. So sorry, whistle stop tour, but thank you very much to our group participating and Vicky for this opportunity.
Thanks, Rebecca. Yeah, a lot to cover there, but good to hear some good practice and flexibility that were raised as well as kind of challenges ongoing. I note that Amber has dropped a question in the chat for you, Rebecca, that you might want to answer in the chat if that's okay. Great. Breakout room 4 was also on the same theme, and that was Kate and Min who were.
Yes.
Thanks.
Thank you. I'll be quick because of the time. So we echoed the issue about digital to divide. We brought up the issue that this is all under the context of Brexit and the added need for EU folks to be concerned about immigration. And so while there was people who are outside of the EU were already dealing with these issues, now this is added population, and that just adds to who needs support in a overly tapped system and in a pandemic where providing support is also very difficult. We really heard about the fact that people had to do extra looking for where resources can be found, and specifically for people who didn't have recourse to public funds, that was a big issue. So the recommendation is to really address and basically get rid of no recourse to public funds, especially for survivors. And we really talked about the longstanding issues about lack of accountability in the NRM in terms of the long wait time, about the data sharing that occurs between NRM decisions and asylum decisions, and that also people entering into the NRM may not actually be clear that if their first responder is law enforcement, the law enforcement might actually inquire about immigration information, and then that immediately can bring up issues regarding immigration. And so there isn't a fair chance when it comes to reviewing their case around modern slavery. So really addressing how it plays out in terms of upskilling first responders, but the accountability of the system in terms of believing people. So it was really important that survivors in our session talked about addressing the culture of disbelief and all the difficulty of coming out and but then being disbelieved. We also talked about informed consent. I think I wanted to highlight that there was also on this just accountability. It wasn't just about legal and immigration, but this is a little bit of my own personal addition here, is that during this time, people are going to struggle to complain about services that are challenging because they're struggling. And it's already been known that it's hard to raise complaints with the Salvation Army or with any of the subcontractors because there is no formal system, and that it's documented that complaints are not followed up. And so in a time where people are just struggling, maybe they're putting up with abuses in housing or with subcontractors. And so it's really an added pressure that, like somebody else said, was already existing, but in COVID heightens the challenge for people to raise these issues. I think that, and we also echoed that it was a real challenge for parents who were trying to get support for themselves, for their children, with no recourse to public funds and the digital divide. And we, in terms of actions, we also wanted people to stop saying that something's going to happen and then not doing it. So for example, the promise of more laptops to children, of course, that's on the government and on the Prime Minister and others, but that actually infuriates more to promise something and to not see it happen. So I think that's it for now, but thank you also to everyone who shared personal lived experiences during our session.
Fantastic, thanks Min, it's really helpful. And last but not least, we've got a few minutes left to hear from group 5. We're talking about risks to children. Is that you, Erica, or is that Liana?
She asked me to do it, so but she kindly took some fabulous notes. Just want to echo what everyone else, all the other facilitators have said, that you know, the discussion was really rich, and it was really a privilege to be able to hear from a range of different perspectives and experiences. So thank you everyone who was in the breakout group. Just going to give a bit of an overview. There were it was raised at the beginning of the pandemic when it came to work with children and young people, that everything was quite quiet, but it was probably more to do with the fact that there weren't people on the ground to recognise what was happening. Also that maybe exploitation had kind of changed and shifted. It wasn't maybe in the places that some service providers were looking or had been used to looking, and so things had really, the pitch had kind of changed during the start of the pandemic. And just because it was quiet didn't mean obviously that exploitation wasn't happening, but there was kind of eerie silence, which a few people reiterated. There was also it was raised that that neurodiversity amongst young people and children was a significant factor when it came to exploitation, and that perhaps some of these young people were becoming particularly vulnerable because they were maybe being groomed online and not kind of, it was harder for them to maybe read some of the nuances of what was going on in that kind of online space. Also that we discussed a lot this kind of the shift from in-person to remote, and how different organizations had to kind of adapt in the time frame during which that had to change, and how in that process that contact with some of the young people that people were working with had been lost because of that shift to online methods. And there was also kind of a bit of a discussion around evaluating this shift to remote support, and for some this had been a source of frustration for certain safeguarding partners because they had lost contact, or they weren't able to sort of communicate and reach out to young people in the same way as previously. But there were also some reflections that remote support had enabled some young people to reach out for support because it was more private, that they weren't going to be seen, for example, in school if they were reaching out for support. So that had in some ways had created a bit of a safety for some people, but obviously this was a very mixed picture. In terms of interventions that have been put in place, there was loads of amazing examples of good practice listed, that some organisations, because of the lack of face-to-face support during the first lockdown, that they had tried novel things to break down some of those communication barriers. And there were some examples of let me just say, I've got them here, art workshops, sport and music workshops, some of these, most of them being delivered over Zoom, and that these had been really effective and popular with the young people. Also, just that thing of listening to the young people and what they wanted during that time, and that they really did miss this in-person support. There were also examples of some organisations posting out activity packs to young people, and how that had been really well received, that kind of more old-fashioned snail mail thing being really effective for the young people, and something that had really been a positive thing and a way of keeping in communication with the young people. In terms of criminal exploitation of children, that some children had engaged better remotely because they were able to kind of do so in a more private space rather than in school. In terms of ongoing risks coming out of the pandemic, concerns were raised around children who've maybe been groomed online during the pandemic, and as they come out in terms of like being able to, coming out of lockdown and school closures, that they may be at risk of meeting perpetrators, and concerns about that. And also that there needs to be support through positive networks of relationships. There were concerns around the mental health legacy of the pandemic for young people. And backlogs in court processes was a massive fear as well. Young people being left to wait in limbo as referrals had been halted, and how the link between those who've experienced online exploitation, and how that might correlate to future trafficking risks. And I know that time's running out, so yeah, just that there needs to be a response at all levels, government level, that there needs to be partnership, and at NGO level and local governments. that's me.
Brilliant. Thanks so much, Erica. Yeah, totally run out of time, but we will be writing up the notes from each of the breakout rooms and developing some kind of briefing, share it back with you. If there's anything further that you want to raise that you didn't get the chance to say today, I've just dropped my email into the chat, and please feel free to email me with anything further. But thanks so much to everyone for your contributions, to the facilitators and note takers too. Thank you.
Thanks everyone. Survivor leaders, if you want to quick debrief, message us for details of a Zoom half-an-hour debrief.
Yeah, sorry, I was just going to say it. Yes, so exactly. And also, we've got our next forum in a month. So if anyone is going to be around detention asylums, if anyone has any inputs they want to do, just let us know. We're also going to have a little AOB at the end about the NRM, because we've had some concerns around different issues with the NRM and the changes. So again, if you've got any feedback on that you want to include, to get in touch with us. And thank you, everyone. Thank you so much also to Vicky and Jasmine, who've both sort of done a lot of work to organise today's event. And yeah, thank you everyone for coming.
Thanks, Tamara. Bye.